So today we are working with RSD in the right foot, and I thought we would give you guys another example of how we treat RSD, and Jennifer graciously allowed us to video her treatment today, or a portion of her treatment. And how long have you had RSD, Jenny?
Since 2008.
Okay, how did it get started?
A stress fracture on the top of my right foot.
Okay, and tell me what your daily life was like.
Horrible pain, shooting pain, excruciating pain, not being able to do daily anything hardly. From day to day, living on medication.
And it was starting to spread, right?
Yes.
Okay, we talked about, refresh my memory, right arm?
Yes. Right hand,
Okay.
the wrist.
And what all have you tried?
Oh, let's see, we've tried medication, we've tried surgeries.
You take lots of medication.
Lots of medication. I was taking lots of Lyrica,
Okay.
lots of pain medication, morphine.
You haven't tried the ketamine?
No.
Okay, thank goodness, because that makes my life more difficult. What we're using on Jennifer is a combination of three, what I call my big guns with RSD. So what I'm doing right here is we are treating the very upper cervical spine, and we do this in patients who had either an old tailbone injury or an old car accident where you had a whiplash injury in the past before you developed the RSD. And nobody ever puts that together with the RSD, but it affects your autonomic nervous system, which is your sympathetic and parasympathetic. Sympathetic is of course the S in reflex sympathetic dystrophy. So this is like a master switch, and if we flip it, it affects your pain all over. We are also using frequency specific microcurrent, if you want to zoom in on that. Yep. And you can zoom in on her foot so you can see the swelling. You can see that right foot is quite a bit more swollen than the other foot. Okay. And the frequency specific microcurrent we are using to treat several different things. We are treating inflammation of the spinal cord, we're treating inflammation of the nerves, we're treating scar tissue of the nerves, we're treating allergic reactions. In your case, you had a spinal fusion, right?
Yes.
How long ago?
2 years ago.
Okay, and the metal that they implanted in her spine is slowly leaking components into her body. So we're treating her for an allergic reaction to that. What else, Deb? What am I leaving out?
Stenosis, toxicity levels.
Stenosis. Stenosis is narrowing of the spinal canal in which your spinal cord sits. And most RSD patients will suffer from this unless they're very young. And that will cause your pain to get worse when the weather is bad, because it literally causes the nervous system to expand and it makes that injury worse. So, Jenny, can you tell me a little bit, let's go through the process today. You came in and your pain was at an 8.
Mm-hmm.
We're having some bad weather.
Hot.
You've been under care for what, 3 weeks now?
Yes.
Okay. And tell me what happened today.
Today I came in and I was hooked up. It seemed to be going okay, and as Dr. K was doing her little magic with her hands, my pain has gone away. It feels like I have a feeling of hot, warm feeling of water on my foot with no pain.
Does it feel weird?
Yes, and it feels funny.
You're not crying anymore, but in the beginning you would cry every time that pain went away.
And well, I just about am now, because I don't know what, it just feels funny. I've been having pain for so long that it's, I don't know, you have to stop and think, look, there's nothing there.
And we actually, when you're done with your treatments, we have to, we don't have tissues here, do we? I'm not going to make you cry.
They're right under.
Oh, we do.
No, it's just, it's amazing from one day to the next how it feels.
It blows your mind.
Mm-hmm.
So we have to, when you're done with your treatment, she has to walk in a special way, which is she hits the ground with her toe first, and then she puts her heel down, And the reason we have to do this, if you have RSD and you have so much pain in a limb, your body forgets that the limb is there. It's only listening to the pain. And once that pain is gone, your body literally doesn't know that that limb is there anymore. So we have to refresh the brain's information and get that updated so your body knows where all your limbs are in space. The difference between how we treat RSD in here, or the neurologic symptoms of RSD, is that we do not treat the pain. We do not interrupt the pain signal. We don't attack the pain signal. We don't try to interrupt the nerve signal, because that is not what's causing the RSD. The RSD is caused by a malfunction in the central nervous system. And unless you treat that, you will never ever permanently get the RSD under control, in my opinion. Anyway, thank you so much.
Thank you.
Today we'll check back in. I thought I would add this, Jennifer. You're done with your treatment. Okay, and you're walking on that foot. Can you normally walk on it?
Not very well, no.
Okay, so this is
It really
different.
hurts. Yeah, this is really different.
Where's your pain out of 10 right now?
A 2.
A 2.
A 2.
Good. And you're walking really well on that. Yay, I'm so glad I got this